Welcome to the Lifeboat Hour with your host, Carolyn Baker.
Everybody knows that the dice are loaded. Everybody rolls with their fingers crossed. Everybody knows the war is over. Everybody knows the good guys lost.
Thank you for joining us again this morning on the new Lifeboat Hour. Those of you who are familiar with my work know that at least since my first book, Sacred Demise, in 2009, I've been writing and speaking about the emotional and spiritual impact of the global crisis on human beings. Now, much has been written and is being written about the impact of the crisis on other species, and I cannot emphasize sufficiently how passionately I feel about the carnage that we're visiting upon other living beings. And the focus of my work continues to be on humans and the imperative of cherishing what has meaning for us, even in the face of physical death. So, given my background, it was with profound excitement that I discovered the work of Dr. Lise Van Susteren, a psychiatrist who authored a phenomenal paper for the World Wildlife Federation entitled "The Psychological Effects of Global Warming on the United States and Why the U.S. Mental Health Care System is Not Adequately Prepared." The paper is online and anyone can read it. Simply Google the psychological effects of global warming and you'll find the PDF. When I discovered this paper, I became so excited about it and how closely it resonates with my work that I felt compelled to contact Dr. Van Susteren, who graciously consented to be my guest on the new Lifeboat Hour. And certainly, emotional preparation for catastrophic climate change is one of the most urgent lifeboats we can build at the moment. Now, Lise Van Susteren received her medical degree in 1982 from the University of Paris. She interned at the Hospital St. Anne and the American Hospital in Paris, and at Hospital Tocoin in Lomé, Togo. She completed her residency training in psychiatry at St. Elizabeth's Hospital in Washington, D.C. Dr. Van Susteren is board certified in general and is board certified in general and forensic psychiatry. She's worked as a consultant to the Central Intelligence Agency, conducting psychological assessments of world leaders as a psychiatrist, evaluating and testifying on behalf of torture victims seeking political asylum in the United States. She's been a volunteer reader for Metropolitan Washington Ear, an organization that records written material for the blind, and as a volunteer provider at homeless shelters for victims of Hurricane Katrina and the earthquake in Haiti. In September 2006, Vice President Al Gore trained Dr. Van Susteren at the Climate Project to educate the public about global warming. And she was named to the board of directors of the Climate Project in 2009. She speaks frequently to civic, educational, religious, labor, and environmental groups about the impacts of climate change, particularly health impacts in the Washington, D.C. area, nationally, and abroad. In 2009, she organized the first conference to focus on the psychological impacts of climate change. And Dr. Van Susteren serves on the advisory board for the Center for Health and Global Environment at Harvard Medical School and is a member of the board of directors of the National Wildlife Federation and the Chesapeake Climate Action Network. Since 2009, she served on the Climate, Energy, and Environmental Committee of the Metropolitan Washington Council of Governments in Washington, D.C. She also serves on the Policy Advisory Board of Gender Rights, Maryland. In 2011, she co-founded Interfaith Moral Action on Climate, a multi-faith coalition dedicated to organizing people of religion and spirituality to speak out against climate change. She lives in Washington, D.C. Well, I could continue with a very long and impressive resume for Dr. Lise Van Susteren, but I'm going to stop here and welcome you, Dr. Van Susteren, to the new Lifeboat Hour.
Well, I am so honored to be here, and I am just spellbound by how prescient you have been, Carolyn, and please call me Lisa, and looking at the work that you've been doing all these years, your books, everything that you're saying. And I'm just spellbound at the sophistication, the connection, the foresight you've had. And so I am just so honored to be talking to you. So thank you so much for inviting me.
Well, I do appreciate your taking time with me today. I know you're trying to get out of Dodge and have a relaxing weekend, so I'll do everything I can to facilitate that. And the first question I want to ask you is, how did you get involved in the work that you're doing? You know, obviously most psychiatrists are working in private practice or doing research or both, but generally they're not writing and speaking publicly about climate change. What brought you to this place in your career?
Well, let me back it up a little bit and say that in the early years of 2000, I was starting to hear about climate change and global warming and greenhouse gases, but I had very young children and I was just preoccupied with bringing them up and tending to their needs. Then in 2005, I ran for the U.S. Senate here in Maryland, and it really started opening my eyes to environmental issues, energy issues, and then gradually focusing almost exclusively on climate issues. And I became obviously applied and then was invited to join the vice president for the training. And it has changed the course of my life, essentially. And I will also add that I can't think of anything that actually is better suited for psychiatrists. And I try to make this case with my colleagues. Who better than us, really, to be talking about bad behavior choices right now that are going to have really terrible consequences down the road, and to encourage us to look at those choices and to do it in a way that allows people to be persuaded and that brings them to the point of feeling as if they not only persuaded, but that they want to make changes. So it's made for psychiatrists. But I've got to do a little more convincing of my colleagues.
Well, you know, you already know that I'm a life coach. I was a psychotherapist for many years. And in my coaching, you know, I work with lots of folks who are very aware of what's happening with climate change. And sometimes, you know, I need to refer people to a therapist, but that's difficult because often what they encounter, not always, but often what they encounter when they go see a mental health professional is, well, dear, you must have some sort of anxiety disorder. Let's find a medication for you, because people this passionately concerned about climate change, you know, are an anomaly to some extent in our culture. What do you think about that?
I think it's insane. And I have seen this drift, reducing all life experiences to nothing but a pill, a prescription pad and a pill. And patient after patient come into my office, and they say that they are so happy to be able to talk about real life experiences. They've been given a pill, and as if all of the sum of human experience could be reduced to some kind of a chemical reaction. It's total insanity. And very often, of course, it's not just anxiety, it's misdiagnosed as ADD, which of course is related to our lifestyles, why people can't concentrate and feel as if they can't focus. We're not living the lives that we are evolved to live, but they're poisoned really, and I'll say poisoned with a diagnosis that isn't accurate and with a medication that very often doesn't work. And the reality is that these are deeper shared experiences that must be addressed.
Well, thank you for saying that. And I know also at the same time that some people really do need medication. And in some cases, medication can be very helpful. So I don't want to throw the baby out with the bathwater, because I want to make that very clear for folks. But it has been so misused and people have been so misdiagnosed so much of the time that, you know, one has to be really cautious, I believe.
Yes, and I'm very glad you kind of rescued me there, because I do get off on a riff. But I am very happy to use medication for symptoms when people are in water that's way too choppy. And so I'm a doctor, I'm a psychiatrist, and I do prescribe medication, and I would prescribe it willingly, or advise people who are friends and family to do the same. So thank you for rescuing me on that. But it is overused, and the issue of the shared anxiety about lives that are out of harmony with nature is not addressed. And it has to be.
Well, I so appreciate your perspective on that. And can you talk a little bit about, this just came to mind. Can you talk a little bit about what happens to us when we're out of harmony with nature? Because that phrase is really important in this conversation.
Carolyn, here's what happens. I'll give you an example that from personal experiences with patients day in and day out. They come into my office. They, I find out, are in a windowless office from 9 to 5. They have no sunlight. They stare at a small screen all day long. They see no green. They are, after they leave the office, again, focused on a screen. They're not getting much exercise. They're eating foods that are laced with chemicals, let's face it, not necessarily nutritious. And they come in and they are either so frazzled or they're zombies and they're so exhausted. And these are lifestyle, again, I understand that there are chemical disorders and corrections that need to be made, but we were never evolved over these millions of years to spend our time in a windowless space, disconnected from the rest of the world except digitally, and deprived of the light that assures a circadian rhythm that has worked for us for these many eras. So we're not living in accordance with how we were evolved. So people are depressed, they're frazzled, and they feel dead. Now, you and I both know that underneath this, and I was very impressed with your podcast with Andrew Harvey, and that is that people may not know, and this is often the case, they don't know what's making them anxious. They just feel lousy. And what most people are not aware of, as you and I both know, is that the issue of matricide, of the degradation of our planet, the news relentlessly about what's happening from climate change is eating away at us in very dark places in our souls. And I have no doubt whatsoever, people may deny it, but I have no doubt whatsoever that on some level, all of us are suffering from it.
Well, Lisa, the reason I've chosen Leonard Cohen's Everybody Knows for my theme song on this program is that I do believe in the collective unconscious. Everybody knows, and everybody feels it on some level.
Absolutely.
Yes,
go ahead.
I'm sorry, go ahead.
No, I was going to say that it's a very tough sell. And we can talk a little bit about why the climate issues are very much evocative of death, of mortality and death. They bring up these forbidden topics. And they'll just comment that I remember, let me, go ahead. What were you going to ask me? You direct. What were you going to ask?
Well, I was just going to, we'll get back to that topic on facing death. We definitely will. But if you could just talk a little bit about what the mental health impacts of climate change are in the moment and what you see them being down the line.
Okay, so let's start with the specific. We know that when weather events, tornadoes, hurricanes, blizzards, floods, fires, that people suffer emotionally. Some people suffer only in the moment if they haven't been hit too hard. Some people will spend a whole lifetime trying to recover. They'll smell smoke, they'll hear sirens, and it's like a PTSD reaction.
Right.
And so we also know, many studies show now, that in the aftermath of these events, there's an increase in domestic violence, an uptick in substance abuse, many times of children, child abuse goes up. So the community frays very, very directly and measurably. And those are the direct impacts. Then there are the indirect impacts on those people who are watching potentially from a little bit afar. We feel bad for people. We worry. Is it going to happen to us? We also have very specific studies now that show that with each degree, degree of temperature rise, there is an increase in aggression linked to temperature and rainfall, increase in assaults, suicides, murders, and so there's a very now substantial concern for what happens when our temperatures go up. It very much looks like we can anticipate additional violence. And again, the same for rainfall. We also know, some of my colleagues at the Center for Health and Global Environment did a study showing that increased carbon dioxide in the atmosphere will affect our judgment, our strategic planning, and our ability to respond to a crisis. So, that's not really a very good combination when you start thinking of how things are going to be degrading and how much more it's going to require of us. So those are kind of the specific things. But then there's the whole other world that's a little bit more nuanced. And this is what it is. And that is, and we as Americans, we're 5% of the world's populations, we're 25% of the greenhouse gas emissions. What is the world going to think of Americans down the road? Where will we be safe? And you know that we will be focusing on the per capita emissions, not going to be able to say, oh, China this, India that. People are going to know that Americans knew there was a problem. We had the means to fix things, and we didn't. And we already know, even in Osama bin Laden's papers, that the issue of climate change has become a rallying cry for jihadists. Then, the deeper sense of what are our children and future generations going to think. I know, dealing with patients day in and day out, that when they look at their parents' mistakes or shortcomings, they spend a whole lifetime hung up on that, in anger, despair, frustration, never really living productive lives themselves. So, and I know you will say future generations, what future generations? But I do still, and I know you call it hopium, but I'm still calling it hope. I still am hoping that there will be people who survive, but that it's going to be a very altered world in which they have their fists in the air or they're crumpled in a fetal position wondering why the heck we didn't take action when we could. So those are some of the deeper things. And then, of course, what is our contribution, our unconscious contempt for those who will follow us? How is it that we don't see, and my colleagues will talk about this all the time, when a family leaves their estate in disarray for the kids, it's often thought of as aggression. And we're not talking climate refugees that are massing on borders trying to find safety. I mean, this is turning our world upside down, and it's really causing a turn to the right. We're finding in Europe many governments now, and including, look at what's happening on our political scene. It has really become a veering to the right. And not that I have any problem with conservative ideology, but the ideologies of intolerance, of xenophobia, and self-centeredness is not a good attitude for our future health. So that's it in a nutshell about the psychological, and that is very much in a nutshell because there's just so much more, but these are some of the deeper issues also that haven't been addressed.
Well, thank you for talking about that. And, I was a psychotherapist in private practice for 17 years, and I know that we as mental health practitioners and healers are not robots. We're almost always, if we allow ourselves to be, impacted by the suffering that we're constantly confronted with. So I have to ask you, what is your own mood about what's happening?
All right. So, I'm mindful also of what Andrew said on that podcast, and boy, did I recognize a lot of the things that he was talking about. I will say that I am the shoemaker's daughter, because I have written about burnout, I've given tips about burnout, and I don't follow a single one. And, well, not a single one. I do follow some, but I have to say that I've been really bad about this, and I have been exceedingly depressed at times, and sometimes fired up with my fist in the air, sometimes grief-stricken, sometimes bewildered. I've had all of those emotions. And particularly, I suffered through this last year. We had a rally on the National Mall, Moral Action for Climate Justice, when the Pope was here, soon after he released his encyclical. And here's what I found, and it was an opportunity for growth, just as Andrew had suggested, but I became really depressed, even as I was so maniacally busy trying to get this thing done, because I realized now in retrospect that I was looking for a kind of magical parent that would come in and take care of all of this for us.
Sure.
And there was no magical parent. There were certainly lots of people helping and working, but they were like me. I was looking for some overarching phenomenon or deus ex machina coming in and just fixing the whole thing. And when I realized it was just us, this was a very, very troubling. I felt every morning I'd wake up and it felt like there was a boulder on my chest. And the rally was good. We had 100 credentialed press. We think we made the point. We brought Black Lives Matter together with the young evangelicals. And we had a really very compelling experience. And then I was even more depressed after that. Curiously, because I kept trying to argue with myself, but you live on two planes. Yes. One is where you know what boxes you're supposed to check and saying, what do you mean? This was great. You know, this happened. You worked together. Blah, blah, blah. But deep down inside, I just felt awful. Mm-hmm. And I have felt awful now for about a year. And I think I'm coming out of it. I know I am. Now I've gone back to swimming, which is one thing that I do that really takes care of me. And I'm convinced, I'm going to make this little blurb, is that I believe we have cutaneous receptors, that water, when it touches, has a very soothing, comforting impact. Yes. Water is our natural element. Mm-hmm. So I am just convinced that that experience, in contrast to many other forms of exercise, at least for me, this is the case, it is a really good way for me to find harmony in my setting. And so swimming is something that I must do for my mental health. The sun's back out here, so maybe I'm turning a corner. But most of all, I think that I have accepted that the pursuit or the quest to find some entity that's going to fix all this is illusory. And I have to say that life does begin on the other side of despair. This is what you have written about. This is what Andrew has talked about. And it's really in accepting our grief that we can find the energy to do what we believe is the right thing, in my opinion. Just as you've said and arrived at so many years ago, and Andrew as well, I'm bringing up the rear. I agree with you. So that's my State of the Union.
I'm talking today with Dr. Lise Van Susteren, a psychiatrist in Washington, D.C., who is the author of The Psychological Effects of Global Warming on the United States and Why the U.S. Mental Health Care System is Not Adequately Prepared. If you've been listening, you know that this podcast is one of the few places on earth where we can have this kind of honest conversation. First of all, how many mental health practitioners do you hear talking about the devastating emotional impact of climate change? And I know you wouldn't have listened thus far if you weren't feeling the impact of climate change emotionally yourself, even now. So I'm committed to continuing to invite quality guests like Dr. Van Susteren to the new Lifeboat Hour. And to do that and to produce this podcast every week, I need your support. So please, when you go to the Podbean page to access the podcast from Facebook, or if you access it from my website, please become a patron of the podcast by making a monthly pledge to the new Lifeboat Hour. I'm not talking about a lot of money. Pledge what you can, but please at least say thank you for this regular weekly quality programming by pledging something. As I've said before, I do this work for you and for all living beings on the earth. So thank you so much for your support. I'm eager now to return to my conversation with Lise Van Susteren, psychiatrist and climate change activist in the area of helping us prepare emotionally for the countless impacts of climate change. So Lise, before I continue with my questions, I'm wondering how people can get in touch with you if they have questions or comments.
They're welcome to email me. My email is simply my initials, LVS, and not surprisingly, perhaps, the number 350. It's very easy at me.com. LVS350@me.com.
Well, as you know, Elisa, I co-authored with Dr. Guy McPherson, Extinction Dialogues, How to Live with Death in Mind. And in that book, I talked extensively about how important it is in a time of potential human extinction to stop running from the topic of death and begin to open to it, as we began to talk about a while ago. So we know that the world has been and continues to be very slow to respond to catastrophic climate change. And my own feeling is that the bottom line has to do with our resistance to facing our own death. And I'm wondering what you think about that and what other reasons you see.
I think you're absolutely right. And then there are many other layers. First of all, it doesn't sell well to be talking about this theme. What people value is a certain optimism and upbeatness, that can-do attitude. People don't necessarily like a reality check. And we have to recognize that we're not necessarily always rational beings. We're emotional beings, and people are easily influenced by the moods around them. And they're fearful that if they talk to people about things that are too sobering, that they don't have the means to pull themselves out of that spiral. So we are also evolved, of course, as others have said, to respond to short-term dangers. We have an amygdala that's kept us alive all these years because it immediately reacts to danger, and then subsequently we see, oh, that wasn't a snake, that was a stick. But we jump out of the way first. So we are evolved to address short-term issues or things in the near term. Now, because people don't want to believe or haven't wanted to believe that climate change was real, it's been difficult, even though there have been things all around us. It hasn't been until Mother Nature has now stepped in and has made wildfires and floods and temperature anomalies something that we all can see. So it doesn't take much imagination anymore to see what's going on. And so those are some of the other layers of avoidance. And our culture has very much rewarded us for avoiding some issues, some reality issues. We don't put money away, even when we should. We have an obesity problem, even though we know it's ruining our healthcare system. My gosh, we're spraying carcinogens, glyphosate, and I'm going to say thanks to Monsanto and others, on our food supply. We're doing a lot of really dumb stuff.
Right.
And we don't hear it, and we don't want to know about it. We just want to stay in our little narrow area where we feel we can function without anybody rocking the boat. So when you want to widespread extinction, including of this species, you know, it's not going to be high on the list of what a lot of people want to talk about, even though we must. So, and I can say that as far as this issue of connecting with death and mortality, two things come to mind. One is I was once on a neurosurgical ward, And I remember as I would pack for the weekend when we would be on call, and I would have this intense feeling of embracing life, knowing that all the people out there who were going to show up at the hospital in the next couple of days are either almost dead or would die. And it gave me such a feeling of the wish to live life intensely while we had it. And I remember thinking, over the years, we never talk about death. It's odd because that's like the biggest thing, isn't it?
Right.
We totally repress this. And I recognize that that is consistent with all of the other things that we kind of deny. So it's not like we're doing something new with climate. We're doing what we always do, which is we try to push things that we think of as unpleasant out of our minds if we don't have the capacity to feel that we are in some ways empowered to deal with it.
Well, thank you for that. And, you mentioned Andrew several times in our conversation, and you know that I work closely for him. Work closely with him, I should say. He founded the Institute for Sacred Activism, and one of the things that he and I frequently discuss is the reality of burnout among activists. We noticed together, he and I'm sure as you do as well, that activists often don't take care of themselves emotionally, or sometimes even resist doing emotional work because they fear that it's going to make them less committed to their activism. I've experienced that it's very important for activists to engage in grief work, particularly around the climate, because of the anguish that they're carrying. And I'd like you to talk about this, please, and specifically, if you have anything else that you want to say about holding all of this in your own psyche as you do your work in the world.
I can attest to the fact that I have not wanted to do any grief work. And it's because I'm attempting to short circuit the feelings. Temperamentally, people do different things. And temperamentally, I'm more of a flamethrower. Though obviously as a psychiatrist, that's another part, a wish to provide a service that I think of as healing, because it brings so much really to me as I do this. So, but the other side of my temperament personality is that I'm very much by nature an activist, fist in the air activist. There hasn't been a place for me to experience grief. And I am inclined to feel content if I bring it up. But I don't like anybody else bringing it up to me, which is, and I'm saying, of course, I do appreciate that you are, but I know my nature is don't talk about it.
Right.
Because the impulse is, I don't want to talk about it. I only want to think about what I can do. And what happens is, as you say, you do become burned out because at some point, you're a grain of sand and so an entire, you're nothing but a grain of sand. And so your activism is paltry unless you can understand that you're doing it as part of a holistic approach to what's happening. If it's just because you're going to find solutions and people think of that as being empowering, you ain't going to get them. And as a climate activist, boy, you better be resilient because you're going to get a lot of rejection. You're going to get knocked down, and you better be able to eat dirt and then stand back up again. And I think that the only way that you can do this is by accepting what the realities are. It bonds you with others. It enables you to heal with others. And I can see, and I'm just realizing now, the sort of inconsistency, because I will bring it up to other people, other activists, and they kind of swat me away. But that's what I do. And I've often thought, why are they swatting me away? Don't they realize that this is how depressing this is? But it's interesting. We bring it up when we feel like it, but it's very much, for many of us, a vulnerability still, even though, as you would aptly describe, it's one of our sources of strength.
Yes, and you mentioned a moment ago the power of water and how much we need it. And so, my experience in grief work is that if we are activists, we need to temper the fires of activism with the waters of grief. And so that's, but you have a really, really good grasp of passion. I really appreciate your passion for all of this and how closely you hold this to your heart, and the tenacity with which you're moving forward.
I know what you mean, the tenacity. And I have found myself recoiling at times and thinking, forget it, I'll just do X. And then without even realizing it, I'm right back at it again, on the phone, doing something, making a plan, going here, buying the domain name, and all the rest. So there is this push. And it's been kind of lifelong. I remember some of the things that I did as a child, fighting curb and gutter in this old country road that we had around our house. And my family has been in politics for many years, and I always say I'm half Irish. So there is that political side of me. Understand where that comes from. But I do realize this is a marathon and is not a sprint. And we need the full range of emotions to deal with it, not just passion and activism, or you're going to get knocked upside the head. It's like saying there isn't going to be a big wave coming, and in fact there is, and it throws you up on the beach big time. And it's happened to me.
Well, I want to talk about another topic that I think is probably dear to your heart. In researching your background and your work, I noticed that you're the founder and CEO of Lucky Planet Foods. Can you tell us more about the company?
Thank you so much for bringing that up. And I have to say that a few years ago, I had this idea. Lucky Planet Foods is a company dedicated to, it's good for people, good for animals, and good for the planet. It contains no animal products, so it's entirely vegan. I don't usually say vegan because people get nervous for some reason when at the idea of just eating plants. But so it contains no animal products. And so it's very healthy as a result. And we are dedicated to producing these products with as low a carbon footprint as possible. That means that ultimately produced in buildings that are and the energy is provided by renewable energy and packaging and all the rest. And I got the idea just because my daughter was a vegan. Now 2 are vegans. And I realized that there really wasn't anything for her to eat. And after she cried twice when I was impatient with her behavior at a restaurant, I realized, you know what? I think I'm the one that needs to change. And so I then realized that there really aren't any good products out there. So I launched it a few years ago, but then got kind of hijacked with our Interfaith Moral Action on Climate, which was a multi-faith group, or is a multi-faith group, that we kind of think of ourselves as the Greenpeace of the faith movement. We're not afraid to get arrested, not afraid to be in the streets. And so I am now back relaunching or reigniting the concept of Lucky Planet Foods. And I have to say that the idea of building something positive, thinking every day, some of it, we have 3 cookies. They're named after animals at risk: black rhinos, Siberian tigers, chocolate chimps, all animals at risk. A portion of the profits are going to go to their preservation. And I've also decided that there are a bunch of organizations that I'm on the board of, and I'd like to give some of the profits to them too. And that has been a really beautiful experience to contrast with the frustration of trying to deal, for example, with inaction here in our federal city, Capitol Hill. So that is a taking care of myself effort that I didn't realize the value of until I became so depressed, and then began to come out of it with the reignition of Lucky Planet Foods. So thank you for letting me make that little blurb, or maybe long, on Lucky Planet Foods.
And what is the website to find out more about Lucky Planet Foods?
Yes, luckyplantofoods.com. Right now it's a landing site, but you will hear about what we're doing. We're starting off with cookies, and we will progress to a grab-and-go food where we use an entree and farro, for example, rather than rice or other not very nutritious grains. If farro was something the Romans used, it's drought resistant. And then we'll have a couple of cookies in there as a psychological reward. It'll be a grab and go, very nutritious. And I think it serves a niche, or I say niche because I'm from Wisconsin, but everybody around me says niche. I always feel like it's not effective. But it serves, we think, something that isn't already on the shelves.
Very good. Thank you for that. And the final question I have for you, Lisa, is I'd like you to talk a little bit about some of the best messaging that you feel we can promote. And I'd especially like you as a psychiatrist to tell us some of the best tools we can employ to become increasingly emotionally resilient in the face of climate catastrophe. And feel free to take your time in answering that question.
Okay. Well, let's talk first about messaging. And one of the things that we know about messaging is the best messengers are people who already have relationships within the group of people that is being addressed. So if you're a faith person of great faith, having a faith leader talk to you is going to be more impressive than having a doctor. Let's say you're in the health sector. Having another doctor talk to you is going to be the best messenger. And educators to educators. So we know the tribal connection is very, very important. And we also know that there are certain phrases that work especially well or don't work well at all. From a political perspective, if you're more on the conservative side of politics, if you mention Al Gore and climate change, there's going to be a little bit of breaking potentially because unfortunately climate change, which is a science, has been conflated with political ideology. So we know that we don't say climate change. What we can say is clean energy, jobs in the renewable sector. We use words that are consistent with a person's political ideology. And we very much know that one phrase that just seems to work well with everyone, and it was initially just directed, from my experience, to especially the evangelical community, faith leaders in the evangelical community, but it really works for everyone, and that's stewardship.
Yes.
So it seems to be one of the best messages, along with clean energy, healthy air, taking good care of our kids. The idea of stewardship and providing sanctuary is something that is an immensely comforting expression and is a message that reaches us in the deeper parts, I think, of our soul and commits us in a way that I think no other word that I can think of does. So talking to people who are your natural allies, because you're one of them, and using certain phrases that resonate, as one probably knows if one is in that sort of tribe, that's the best. And of course, speaking from the heart with passion is always something we need to remember. And I have talked to scientists about this. Just looking at your shoes while you're talking about data, it's really that was a snide remark, but I have said to them, don't look at your shoes. You've got the data, yes, you've got the science, but you got to pound the table. People have got to feel what you're saying too.
Exactly.
They can't just have an analytic approach. It's not going to move them. We got to sustain them by looking them in the eye and showing how you feel about what's happening. So it's the emotional appeal. Now, people are on different ends of the spectrum, so you want to try to stay in the sweet spot so you can get both. So that's messaging. Not to be too rational, not to be too emotional, but to be somewhere in that sweet spot in the middle. So now you asked about resilience.
Yes.
Boy, that is, I've always got an answer for everybody else. But when I bring my own self into it, I have to wonder. it is absolutely critical that we embrace those things which create a balanced life. And as an activist, it is sometimes tough, especially here in a place like Washington, I think, which is just all policy and all NGO and all valedictorians kind of scrambling for their spot. So there's a very competitive, power-driven mood here. And that's really not good for a balanced experience. Out there in the Northwest, you know, you've got the beauty, and look, there you are with this beautiful screen of green behind you, and I've got a white wall. That. But the knowing that our connection with family and really valuing those relationships is just absolutely imperative. And acknowledging our feelings to others, whether they're ready for them or not, and letting others also acknowledge their feelings to us, which is something that's a little bit harder for me to do. And if you go on Grist, your viewers perhaps are aware of Grist, and type my name in, you'll see I've got 10 do's and don'ts about how to avoid burnout.
That's grist.org, right?
Yes, it is. Yes, grist.org. And I have to say that I go in and out of following my rules. And I will say, okay, no more computer after 9 o'clock. That's it. No emails, nothing. You're reading, and I downloaded the 100 best books on Time. Time Life has 100 best books. I read Tom Sawyer, reread Tom Sawyer, reading Pride and Prejudice now. Again, or no, never started a couple and finished. So reading the classics, I think for me, just as it really transports me.
Right.
The reality is, though, that I'll be good for days, turn around, and there I am back again doing emails, and I'm thinking, what? I thought I had all these rules that we were going to follow. I think to myself. But so, you know, and there are games that we don't play anymore that are just so enlivening. I love card games and the other interactive games with people. That's where we can heal. And of course, your grief sessions, these seminars that you've so these are all these are some of the things that I think are so important to get us away from what I call a repetitive motion, a psychic repetitive motion.
And I'm sure you would agree with me, because we talked about this a little bit earlier, that spending time in nature, quality time in nature, is incredibly important.
It's imperative, because that's really the force. That's what we're working for. That's what's the driver. And
Exactly.
That community, about so many of the things that you've talked about that I don't often hear, is this love of other species too.
Yes.
They're our brothers and sisters too. And we have every bit as much of a commitment, ideally, to them. They're depending on us. And this is the stewardship. This is, you know, we're the magic parent here. And it is such a way to find a source of love in ourselves by helping others. And so we get as much as we give when we're in nature, connecting, reconnecting. This is how we evolved. This is not a foreign land for us. This is where we came from. So we're reconnecting with our roots, and that even the salmon goes back to spawn in that same stream. If we want to feel a sense of home, we better be going back to the place we came from, and that's nature.
Today, I've been speaking with Dr. Lise Van Susteren, psychiatrist and author of a powerful World Wildlife Federation paper entitled The Psychological Effects of Global Warming on the United States and Why the U.S. Mental Health Care System is Not Adequately Prepared. Again, Lisa, people can contact you where?
My email is simply my initials, L, V as in Victor, S, Sam, the number 350. at me.com. And I will just add, my husband said to me, isn't that kind of like self-centered? I'm sorry, that's an Apple. It's my Apple email at me.com. So lvs350@me.com.
Lise Van Susteren, thank you so much for being with me today on the new Lifeboat Hour. And thank you all for listening today. Until next time, this is Carolyn Baker. Be well and be safe.
Thank you, Carolyn.
Thank you for joining us today. You can hear all podcasts and learn about Carolyn Baker's other works at www.carolynbaker.net. Her daily news digest is available by subscription and is delivered to your inbox 7 days per week with real news on economics, environment, geopolitics, civil liberties, and cultural issues, plus links to articles on inspiration and resilience. Come sail with us again next week on the Lifeboat Hour.